Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I have a repeat guest to the Insights Lounge, Mr. Eric Grossman. Eric, welcome to the interview.
Thanks, Kate. Thanks for having me.
Happy to have you. We saw you last at AHIP, and now we're here in Chicago at the Oliver Wyman Summit. So Eric, you are the CEO of NextHealth Technologies. You had so many great things to say at AHIP. I kind of wanted to go back and re-explore some of those topics. So, Eric, in your role at NextHealth Technologies, could you have predicted the exit of so many health plans from the ACA marketplace, and could these exits have been avoided?
You know, I think it's a great question. Hindsight's 2020, and it's easy to be a Monday morning, armchair quarterback.
Yeah.
But I think sort of is my answer. You know, I'm a big proponent of market forces versus public policy sort of driving the market, but we sort of had an untenable situation with all these uninsured Americans. But I think there were really two X factors that you kind of saw as sort of what may drive exit. And I think the first is public policy around the individual mandate. And unfortunately, it hasn't been strong enough to keep the healthy people in, to drive sort of the fundamentals of insurance, which is you got to have a balanced risk pool. So without that, health plans have been left with a lot of expensive risk. Mm-hmm. And that kind of comes to the second X factor, which is market forces. And unfortunately, a lot of these smaller health plans, in my opinion, sort of followed the bigger ones in terms of their pricing. And a lot of the bigger ones kind of came in with a low-cost narrow network plan design, and unfortunately, because of the prior X factor, it created an environment with a lot of losses that little health plans couldn't sustain, so they had to exit. So in hindsight, those were X factors. We didn't know how they would play out, and it's led to a lot of shakeout. But as Obama says, I think there are things that we can improve upon and correct. Given that we have so many more people in the system, there's got to be some benefits there.
Right, absolutely. It's here to stay, isn't it? So, all right, well, let's take a look at NextHealth Technologies and what you're pros at doing. So you give the consumer some nudges to help change behaviors. I was hoping you could kind of give us some scenarios where those nudges might take place.
Sure, and how they impact behavior.
For sure.
Sure. So the first thing that we do in driving consumer behavior change is find someone among millions of members who the analytics thinks that we can be successful at changing behaviors. A lot of people don't want to change, or they're too acute, they're too sick to change. So let's take out-of-network usage. So we talked about narrow networks. That's when you leave the health plan's network and get a higher deductible, higher copay, and a higher negotiated rate, which is not a good thing.
No.
But the majority of people, when they go out of network, they don't know they go out of network. And it could be thousands of dollars to any consumer or to a health plan. So the first thing is, let's take Sarah Gomez. We found her through the analytics. And she's a 25-year-old mother of two. She's lower income and lives in the city. And we found that she has no PCP, relatively little experience with the healthcare system, except she's taking her two children to the ER for avoidable reasons, and it's a freestanding ER and it's out of network.
Oh boy.
So that visit costs the healthcare system about $1,000, and up to her deductible, she pays all of it.
Right.
Okay. So we found her. She's impactable, right? Because she's going for a reason that we think is avoidable. She's going after hours. She's her kids. She works, and she's got kids, so we can all relate to that,
Sure.
right? So that's the who. The second thing we do is we got to communicate with her, and so NextHealth reaches out to her via phone call. We get her on the phone after 5 p.m. and we educate her that for low acuity or flu or stomach ache, that hey, there's a freestanding urgent care center that's near your house that you can go to that will save you a lot of money. And Sarah's on the phone saying, well, I didn't even know I went out of network.
Right.
I haven't got the bill yet.
Right.
Or I didn't understand a bill. It says it's not a bill, so I didn't pay it. And we say, hey, can we send you, we know she has a cell phone, can we send you a cell phone wallet, the kind of thing you put on the back to put your credit card in,
Yeah.
that says, need help, text 2600 to this number, and it returns, 6 freestanding in-network, she doesn't really need to know that, accepting patients, urgent care centers within 5 miles of her phone. And it's at the point of need. It's not a phone
Right.
call, because we all forget. It's when your kids are sick. Like, what do I do? And it's either a refrigerator magnet, a cell phone wallet, something sticks on your phone, and then we send it to her, and we wait, and we measure the data. And then the third thing we do is we say, how well did it work? And we found for Sarah and hundreds of other Sarahs like her that campaign worked. And she used the SMS text vehicle the next time her kid had a stomach ache. And she went to the urgent care center, because we know we get the claims data. And then what ends up happening is we have machine learning algorithms that then say, hey, anytime a Sarah presents, we're going to send more Sarahs to that campaign that was carefully designed using what we call a nudge to get her to a more optimal care setting. In that situation, Sarah just saved, $900 net of the urgent care fee, and if she had met her deductible because she went twice, then the health plan, in your case GuideWell, would save $900 in claim savings, and you add that up over millions of members, it's a huge turn of the dial.
And really, it's as much as it's beneficial to the cost, the cost benefit of that approach. I imagine that the experience for Sarah Gomez and everyone like her is also far better, because she's getting, like you said, the help at the time that she needs it, and probably going to an urgent care setting versus an ER. Who wouldn't prefer to be in something that's going to be more efficient when you don't have that much time in a sick child?
Right. I mean, how many advertisements do you see at the airport or JTB Boulevard?
Right.
Advertising no wait time for the ER.
Right.
If that's all she sees and all she knows, that's what you're going to do.
Right. All right, well, let's take a little bit look down
Sure.
the road. Okay, so there's some other trends that might disrupt the health industry. And from your perspective, what are some of those things that you think can really help change the way we're doing business in the health industry today, be it blockchain or something else that might be on your radar?
Right. Well, I think blockchain is a good example of where sharing data in an open source, cloud-based environment has helped other industries like Bitcoin and others. And I think one of the presenters here, Chris Kay from Humana, talked about blockchain. But I don't think there's a silver bullet around, sort of sea change events. I do think that the sea change is large enough to drive major change in the industry, and I think I like the 3 C's. So the 3 C's are, the first one is cost. Well, obviously paying out $8 in claims cost every $1 in premium isn't viable for any health plan, regardless of your reserves. So that's led to the second C, which is compression. And you mentioned some of the sort of what's going on in the market with ACA. And then the last C is consequence, whether companies are going out of business or policy change in Washington. So I think those 3 C's breed innovation, and there's no better drive of innovation than desperation.
That's a good point. All right, one last question, maybe a little bit closer to home. Any other trends worth watching for exponential growth in the efficacy of prescriptive analytics?
So those were some big words, so I'll tackle those one at a time. I typically don't understand more than 3 syllables, but I'll take those. I would say that the biggest trend is the continued losses stemming from the Affordable Care Act is driving health plans and hospitals to absolutely focus on solutions that are presented at this conference that drive attributable medical cost savings and consumer behavior change. The word is attributable.
Right.
How do we know that when I reached into a screwdriver that it truly was my screwdriver that turned the screw? So that's attribution. And I frankly don't think health plan executives really care about the sausage machine. They need outcomes.
Right.
And it just so happens that prescriptive analytics, or what to do next, the what and the how well, and randomized control trials and machine learning are just absolutely no regret investments that you can make in the wake of all the market forces, all the headwind we're up against.
Excellent. Well, Eric, thank you for keeping it real here with us at the Guidewell Insights Lounge.
Right.
Always nice having you as a guest. My name is Kate Warnock. We're going to be up with another guest in just a moment. Please keep watching.